Before starting with today's topic, which is pregnancy and labor, I would like to clarify that pregnancy is not a disease. So, next time when you see a pregnant lady, please do not say she is sick, as pregnancy is not a disease. So, let us begin by knowing what is pregnancy. Pregnancy, which is also known as gestation, is the time period during which an offspring develops inside a mother's womb. Pregnancy spans for 40 weeks, but yes, 38 weeks to 42 weeks is also considered full term. Pregnancy is divided into 3 trimesters. First trimester from 0 to 12 weeks, second trimester from 13 to 26 weeks, and the third trimester from 27 to 40 weeks. So these are your 3 trimesters of pregnancy. Now, talking about labor, obviously I will be talking about normal vaginal delivery. So what is labor? Labor is the process by which the fetus comes out from the uterus to the vagina to the outside world. So, a strong contraction of the uterus is necessary for the fetus to come to the outside world. Now, the process of labor. Now, when labor occurs, there is 2 types of process which happens. That is known as effacement and dilation. What happens in effacement is there is shortening and thinning of the cervix, whereas in dilation there is dilatation of the cervix. The labor is divided into 3 stages, stage 1, 2, and 3. Your first stage is further divided into cervical dilation phase, middle phase, and your transition phase. What happens in cervical dilation phase is your cervix, it dilates from 0 to 3 centimeters, and there is contraction of the cervix. In middle phase, there is dilation of the cervix from 4 to 7 centimeters, and the contractions of the uterus is more strong and regular. The third one, transition phase, your cervix dilates from 7 to 10 centimeters again, and here in this phase there is more stronger contractions and regular contractions of the uterus. So moving on to stage 2 of labor, in stage 2 there is expulsion of the fetus. Now in stage 2 what happens is there is increased abdominal pressure from the contractions of your abdominal muscles and the diaphragm. This force pushes the fetus from the uterus to the vagina to the outside world. So yes, there also has to be relaxation of the pelvic floor for a normal vaginal delivery. Stage 2 is further classified into many stages. So I will be explaining each stage clearly. Kindly relate my words with the picture shown. The first one being engagement. What happens in engagement is the transverse diameter of the fetal head passes through the pelvic inlet. Next, descent. There is continued downward progression of the fetus. For the next, flexion. When the fetus meets the resistance from the floor of the pelvis and the cervix, the fetal chin is brought closer to its thorax. Fourth one, internal rotation. The fetus turns its occiput towards the mother's symphysis pubis when its head reaches the level of the ischial spine. Next, extension. The flexed fetal head reaches the vulva, then it extends its head, bringing the base of the occiput in contact with the inferior margin of the maternal symphysis pubis. This phase ends when the fetal head is delivered. External rotation, lastly, the fetus rotates its occiput towards the mother's sacrum to allow its shoulders to pass through the pelvis. So this was all about fetal descent. Next, what happens is the expulsion. The anterior shoulder of the fetus, it passes under the symphysis pubis and rest of the body follows. In this way, the fetal is brought to the outside world through normal vaginal delivery. The third and the last stage of labor is your placental stage and uterine involution. What happens in this stage is, after the fetus comes to the outside world through the vagina, there is further contractions of the uterus. Now, this happens after 5 to 6 hours of the delivery. The contraction, it takes place where the placenta, it comes out through the vagina again. There is also the formation of hematoma in the uterine placental junction to stop the bleeding. But yes, the bleeding continues for 3 to 6 weeks post-delivery. And also, the size of the uterus, it remains slightly enlarged than the normal size after the delivery. Thank you. Yes, this is all about pregnancy and labor. In my next video, I will be talking about pathologies related to pregnancy and also its rehabilitation. Thank you.